Hey everyone, my name is John Freeman. I'm a physical therapist assistant and personal trainer who specializes in postural analysis and orthopedic injuries. The reason why I'm making this video is to provide some education for anybody who has low back pain caused by a bulging disc or herniated disc or a ruptured disc, same two things, and may be considering getting a microdiscectomy to relieve the pain. I am actually 24 hours out of microdiscectomy surgery to remove a disc herniation in my L5-S1 disc. That was a posterior lateral bulge causing left side sciatica symptoms. I'm going to get into how I'm feeling a little bit later, but first I wanted to give you a history on how I hurt my back and some of the feelings that I went through. So I'm 29 years old now. It was about 10 years ago. I was 19 years old. I was heavy into weightlifting and I was doing roofing as a career at the time. So a lot of lifting at work, and then I'd go to the gym and lift heavy as well. At the time I was just trying to lift the heaviest stuff as possible, which probably isn't the smartest idea. I was deadlifting 455 pounds at the gym one day and felt something kind of pop in my low back. At the time I thought I was too young to have a disc issue, so I just counted it off as like a strained muscle, and that's what the doctor told me at the time as well. And then I was driving to New York one day for work, and I had severe like hamstring pain, which I thought may be a hamstring strain, but it almost brought me to tears. It was about a 3.5, 4 hour ride down to Long Island, and I couldn't get comfortable. I had to pull over the car multiple times. I ended up making it there, and the pain subsided after like 3 to 4 days. Since that point in time, I refused to give up my lifestyle, lifting weights and working as a laborer, because those are two things that made me happy, and I thought I was very good at them. So I was able to manage the pain and do the things I wanted to do for a while, just by keeping flexible, working on my core strength. Over the course of 10 years, I would deal with maybe 1 to 2 times a year where I would hurt my back at the gym, or even something as simple as lifting an object wrong. Then it would cause a flare-up in my back, causing me to barely be able to walk. I can recall multiple times getting up in the middle of the night because I couldn't get comfortable. I'd have to put on a jacket and walk around the streets at 2 or 3 in the morning just to give me some relief to go back to bed. I was never really taking a whole lot of medicine to manage the pain, which now as I'm a little bit older I realize there's stuff out there to manage pain for a reason. So I highly suggest, if you're dealing with the pain and you have prescribed medicine, take it as prescribed in order to just give you some relief before you can get back on your feet again. So that covers most of what happened in the past, and then I'll go into how I decided on having microdiscectomy surgery this year. So it was January 2016. I started training for a Tough Mudder. I got onto a jogging program that was supposed to be training me to run a half a marathon. I got about 3 weeks into the program where I was running up to 3 miles. And then one day I set out for a 3-mile run, and I got about a half mile into my run before I felt severe radiating symptoms down my left leg, which I have felt before, so I knew what it was. Tried to run through it, and it brought me to my knees. I had trouble walking back to the start line to get back to my house. Gave it a few days, rest, iced, ibuprofen, helped a little bit. As soon as I tried getting back into running, couldn't do it anymore. So I kept trying to do that over the next few weeks because I had a Tough Mudder to run for, and it just wasn't working. So I ended up doing like the bike, the elliptical, things that were a little less stressful on my back. I made it through my Tough Mudder, which actually wasn't as bad on the back as I thought it was going to be, but I paid for it a couple days later. I'm also an avid golfer, so I was golfing once a week, playing 9 holes, and I would be crippled afterwards, like to the point where I was having a rough time sleeping. The next day I could barely do stuff around the house, like cut the grass and just do daily chores. Then during the summer, going to work every day, I work as a physical therapist assistant. I'm on my feet all day. It was getting to the point where I'd get 1 to 2 hours into my day, and I would just feel that lightning bolt of pain shooting from my left buttocks all the way down the back of my leg underneath my foot. And that's when I decided that I needed to go seek some professional advice because of it affecting my daily activities. So I did make a doctor's appointment to see Dr. Lucas out of Rhode Island Hospital, where he gave me some medication to deal with the pain, which again I told you I really don't like to take unless I have to. So he also ordered an MRI, which revealed a severe disc herniation in my L5-S1 disc that was protruding towards the left side and posterior, which means to the back. So I tried to go ahead. He gave me two options: to get a spinal injection to deal with the pain or get a microdiscectomy. Now, I had known over these past 10 years that surgery was always an option, but my last option. So I told him I didn't want surgery. We did the injection, which actually helped a little bit. I think if I had a lifestyle where I was able to rest a little bit more, that I would be able to deal with the pain with that injection. But again, I have a lot of things that I like to do that are physical. So I was still unable to run, still unable to golf. I just had a daughter 4 months ago, and she was getting tough to carry around and lift. So I finally made the decision that I need to get healthy for my family. So I made the decision to go ahead and get a microdiscectomy done. Some of the things I knew going in from being in my profession, that posture is going to have a lot to do with the outcome of the surgery. Chances are, if you have a back problem, your posture is probably out of whack a little bit. There's probably some muscle imbalances going on, unless you had like a traumatic injury, such as like a car accident or a fall or a hit. So some of the postural things I've been working on, I'm actually going to share in some future videos. That should be very exciting, because that's the stuff that's going to get you back strong again. Surgery is an option that sometimes people need, but in order to prevent reoccurrence, you need to work on your posture, make sure that you're in balance, make sure that your hips are nice and balanced and stretched out, and that your core is very strong. So those are some videos that I'm going to be putting up soon, but I just want to touch base on the surgery. So I had arrived at Newton Wellesley Hospital at 6 a.m. yesterday to have the surgery performed. I ended up going with Dr. Robert Benko. He's a very skilled spine surgeon out of Newton Wellesley Hospital. He owns his own practice. Great doctor. So I arrived there at 6 a.m. They went through the pre-op. Just took my vital signs. I met with the doctors, the anesthesiologist, and the nurses, who did a very good job in answering all my questions. They basically just get you ready in the bed. They hook you up to an IV. They give you some anti-anxiety medicine, which helps a lot. And then before you know it, you're out and recovering. So when I woke up, some of the things I felt, the first thing they do is they put you in a pain management recovery area, where they're basically just pumping pain meds into you until you're able to manage the pain, which didn't take too long for me. I didn't feel a whole lot of pain afterwards. It was just a little bit tight. And then from there, they just make sure that you have full bladder control and their pain is manageable before they send you home. So they sent me home with a prescription for oxycodone. I'm supposed to be taking one every 3 hours. 1 to 2 every 3 hours. They're 5 milligrams. I've been taking like one every 4 to 5 hours, only because it makes me really drowsy, and it's kind of hard to do anything on them. So I just had my first night's sleep last night, which was a little challenging. I felt a lot of tightness in my low back, and then I went into the surgery very flared up in my sciatic nerve. I was actually barely able to walk into the hospital, so I think that some of the residual sciatica pain is still remaining, only due to being so flared up when I went in there. Nerves don't heal overnight like that. They take a few weeks to a few months, depending on how pressed up your nerve was against the nerve root itself. So I think that I definitely got some relief right off the bat from the surgery. my sciatica pain is a little bit more manageable already. But I think it's going to be a couple weeks before that nerve pain goes down. So as of now, I was able to sleep every like 3 to 4 hours last night, waking up to take a pain med, and then just get comfortable in bed. But a couple tips for sleeping. If you're going to sleep in the bed, I suggest, depending on if you're a side sleeper or a back sleeper, if you sleep on your side, I highly recommend buying a body pillow, which is basically just a 5-foot long pillow, and you put it right between your knees on your side, and you can hug it, and this is going to keep your hips in very good alignment, which is going to protect your low back. So it's going to be like a decompression type of sleep, versus just letting your knees go together, because that's going to put a little twist on the spine, which you don't need at this point. And then if you are a back sleeper, I recommend just folding up a towel, putting it right on your bed, and you're going to place that right on your low back and hip area. Then you're going to put a pillow underneath your knees, so you're in a bent position with your knees, and the pillow's underneath your knees, and that will give you a good position to sleep on your back. I wouldn't recommend sleeping on your stomach, as that's going to compress the discs that were just worked on, so you want to avoid staying on your stomach for now. And then in terms of sitting and standing, just a couple things to think of. Like I said, we're going to be touching a lot more about posture soon. But for now, like when you're in a seated position, a couple things you want to think of is you want to sit up nice and tall, and you just want to act like you're squeezing a marble in your belly button, and that's going to engage your intrinsic core muscles, which is going to help to protect the spine, and it's going to give you a little bit of relief while you're sitting, so you're not just hunched over. So once you make that move by bringing your belly button in towards your spine, acting like you're pinching a marble in there, just going to pull the shoulder blades back a little bit so they're down and relaxed, and that's going to give you a good seated posture. And then also you can do those same things when you're standing up as well. So if you look at it from the side, I'm going to touch base a little bit on like a posterior pelvic tilt. So if you look at my low back, you'll see that little lordotic curve, which is just an extension of the low back, which is natural. I'm going to decrease that a little bit by putting my hands behind my hips. And you're just going to do a little posterior pelvic tilt. You can do that by bringing your belly button in. It's going to keep a nice neutral spine, going to help protect the low back, again, to give you a little bit of relief when you're standing up. But this is my first video. I'd like to track my progress over the next 6 to 8 weeks at least. Maybe not every day, but every time I make progressions and regressions, I'm going to be sharing that with you guys. Also, I'm going to be starting my rehab exercises either later today or earlier tomorrow, depending on how that sciatica pain feels in my leg. So look forward to teaching you guys some more cool stuff. For now, I just wanted to share my story, and let's get ready to rehab this bad boy. All right, good luck to you. I hope everybody feels better out there.